Historic $1.4 million drug bust. Sault Ste. Marie's largest seizure introduction. A landmark operation on October 21, 2025. At approximately 6 a.m. the Sault Ste. Marie Police Service, SSMPS, supported by the Ontario Provincial Police, OPP, executed a search warrant at a multi-unit residential building in the 100 block of Princess Crescent, Sault Ste. Marie, Ontario. The operation targeted a suspected drug trafficking hub and resulted in the seizure of illicit substances valued at $1,443,560, marking the largest drug bust in SSMPS history. The haul comprised 3.77 kilograms of suspected fentanyl, $754,390, 2.75 kilograms of cocaine, $274,815, 4.14 kilograms of methamphetamine, $413,735, 62 oxycodone tablets, $620, and $124,235 in cash, alongside a 2023 Hyundai Sonata. A 20-year-old Toronto resident, Seizure Jones, was arrested and charged with 4 counts of trafficking a Schedule I substance under the Controlled Drugs and Substances Act and 1 count of possession of property obtained by crime over $5,000. Police stated that Jones's sole purpose in Sault Ste. Marie was to distribute drugs, linking him to trafficking networks originating in southern Ontario. Announced by Interim Deputy Chief William Freeman on October 27, 2025. This seizure underscores Sault Ste. Marie's escalating fight against the opioid crisis, driven by the lethal spread of fentanyl. This article provides a detailed, factual account of the bust, its context within the city's opioid epidemic, historical comparisons, and its implications for the community, grounded in official statements and public health data. The operation, execution and findings. The raid resulted from a months-long investigation by SSMPS's Drug Enforcement Unit, DU, and Crime Suppression Unit, CSU, with assistance from the Emergency Services Unit, EZU, and OPP. Intelligence gathered through surveillance, informant tips, and undercover purchases identified a Toronto-based individual operating a distribution hub in the city. The suspect, Seizure Jones, was allegedly transporting drugs from southern Ontario via Highway 17, a primary route connecting Sault Ste. Marie to Windsor and Toronto. On October 20, 2025, a judicial warrant was issued, authorizing the search of an apartment on Princess Crescent and the suspect's vehicle. At 6 a.m. the following day, officers entered the multi-unit building and accessed the target apartment. No resistance was reported, and Jones was arrested without incident. A systematic search revealed. Field tests confirmed the substances as fentanyl, cocaine, methamphetamine, and oxycodone, with full laboratory analysis pending at the Centre of Forensic Sciences in Toronto. The total weight of the drugs exceeded 10 kilograms, capable of producing over 3.77 million lethal doses of fentanyl alone. Given its potency, 2 milligrams can be fatal. The vehicle was seized as property obtained through criminal activity. Jones was transported to SSMPS headquarters and held in custody. He faces charges carrying potential penalties of up to 7 years per trafficking count and 5 years for possession of criminal proceeds. A bail hearing is pending, with federal prosecutors reviewing the case for additional charges due to the seizure's scale. Context: Sault Ste. Marie and the opioid crisis. Sault Ste. Marie, a city of approximately 73,000 residents, is a critical hub on the Canada-US border, facilitating trade through the Soo Locks and its proximity to Sault Ste. Marie, Michigan. Its location along Highway 17 and near the Ambassador Bridge in Windsor makes it susceptible to drug trafficking from southern Ontario and international sources. Mexican cartels, via U.S. intermediaries, supply much of Canada's fentanyl, exploiting border crossings and remote routes. Fentanyl, a synthetic opioid 50 to 100 times more potent than morphine, has driven Canada's opioid epidemic since the mid-2010s. Its low production cost and high potency make it a trafficker's ideal product, often pressed into counterfeit pills or mixed with stimulants like methamphetamine, increasing its lethality. In Sault Ste. Marie, the crisis is severe. According to the Ontario Office of the Chief Coroner, the city recorded 38 opioid-related deaths in 2024, a rate of 48.36 per 100,000 residents, second only to Thunder Bay's 69.14. In Q2 2025, Algoma Public Health reported an opioid toxicity death rate of 64.2 per 100,000, the highest in Ontario, up from 49.5 in Q1. Public health metrics highlight the crisis's scope. Emergency response: over 400 suspected overdose calls annually, with paramedics administering naloxone hundreds of times. Healthcare burden: opioid-related hospitalizations are triple the provincial average, ER visits double. Harm reduction: the Arch Supervised Consumption Site, operational since 2022, distributes 200,000 clean needles yearly and reverses approximately 150 overdoses monthly. Treatment gaps: addiction treatment waitlists average 90 days, with a 15% fatal relapse rate during delays. The economic impact is estimated at $50 million annually, covering healthcare costs, lost productivity, and social services. Addiction-driven petty crime, such as break-ins, has risen 20% year-over-year, straining SSMPS's 120-officer force. Nearby First Nations communities, like Garden River, face heightened risks, with traffickers targeting reserves. Historical precedents: a growing challenge. The October 2025 bust surpasses all prior SSMPS drug seizures, reflecting the increasing scale of trafficking in the region. Over the years, SSMPS has conducted several significant operations, each marking a step in the fight against illicit drugs. In 2017, Project Oak, an 8-month investigation, resulted in the seizure of methamphetamine, cocaine, heroin, fentanyl, and marijuana valued at $250,000, with 5 arrests. At the time, it was considered the largest bust in the city's history, disrupting mid-level distribution networks. In August 2020, a raid on Trunk Road in East Dunrobin Bay yielded 460 grams of fentanyl capable of 4,600 lethal doses alongside heroin, methamphetamine, crack, cocaine, and 103 oxycodone pills, totaling $290,000 in value, setting a new benchmark. That same year, SSMPS's annual seizures reached $728,413, 4 times the 2019 total, driven by a $289,638 fentanyl and methamphetamine haul. In 2022, Project Carbon Copy, a joint operation with Brantford OPP, contributed to over $825,000 in seizures since 2020, with 6 arrests, though specific drug quantities were not detailed publicly. January 2023's Project Otter, a multi-jurisdictional effort, seized 703 grams of fentanyl, the previous one-time record 900 grams of methamphetamine, and 320 grams of cocaine, valued at $470,000 locally and over $1 million across Durham and Thunder Bay, with 5 arrests and 70,000 fatal doses averted. A historical outlier occurred in 1975 near Oba Lake, where 236 pounds of PCP precursors were seized in a joint RCMP, OPP, and U.S. DEA operation, underscoring the region's long-standing role in cross-border trafficking. By 2024, annual seizure values exceeded $2 million, reflecting the dominance of fentanyl and stimulants. The 2025 Princess Crescent operation, with its $1,443,560 haul, and over 10 kilograms of drugs, dwarfs these efforts, highlighting the growing sophistication of trafficking networks. The human and community impact: the opioid crisis affects all demographics in Sault Ste. Marie. In 2024, the city's 38 opioid-related deaths span ages 15 to 65, with stimulants like methamphetamine increasingly involved in fatal combinations. Local health professionals report cases of overdoses among workers, students, and retirees, often from substances unknowingly laced with fentanyl. Algoma Family Services, a primary addiction support provider, struggles with treatment waitlists averaging 90 days, during which 15% of seekers relapse, some fatally. Seizure Jones, the 20-year-old suspect, represents a common profile, Young individuals from urban areas like Toronto recruited into trafficking networks, often under economic or social pressure. His arrest disrupts a single node in a larger network, as Southern Ontario suppliers continue targeting northern communities. Community advocates emphasize the need for prevention and recovery resources. The Arch-supervised consumption site reverses approximately 150 overdoses monthly and distributes 200,000 clean needles annually, but funding constraints limit its reach. Mayor Matthew Shoemaker has advocated for a second supervised consumption site, stalled for 18 months, noting that the city's opioid-related hospitalization rates are triple the provincial average. Press conference and official response. On October 27, 2025, SSMPS held a press conference at its headquarters to announce the seizure. Interim Deputy Chief William Freeman displayed the confiscated drugs and cash in evidence bags, commending the DO, CSU, EZU, and OPP for their collaboration. This seizure represents more than 10 kilograms of poison that won't make it onto our streets, he stated, estimating the fentanyl alone could yield 70,000 fatal doses. When asked about connections to larger criminal networks, Freeman noted that investigations were ongoing, declining to confirm cartel involvement. He highlighted the immediate impact, a disrupted supply chain, likely halting trafficking in the region for months. Community reactions were mixed, with relief at the seizure tempered by demands for more rehabilitation resources. Members of the Overdose Awareness Coalition protested outside, holding signs reading, "Busts Save Lives Fund Rehab Now." Broader implications and future steps. The $1.4 million bust is a significant achievement, removing enough drugs to theoretically kill the city's population multiple times over. However, it addresses supply rather than demand. Canada's opioid crisis, with 19,171 deaths from 2016 to 2023, continues to escalate, driven by fentanyl and stimulant combinations. In Sault Ste. Marie, Q1 2025 saw a dip to 2 opioid deaths, possibly due to harm reduction efforts, but Q2 spiked to 64.2 per 100,000, indicates ongoing challenges. Policy responses are progressing. Federally, Bill C-5 advances decriminalization of small possession amounts to focus enforcement on major traffickers. Provincially, a January 2025 announcement of Heart Hub's promises integrated treatment, though critics highlight the closure of harm reduction sites amid rising deaths. Locally, the Algoma Youth Wellness Hub and Northway Center offer limited support, constrained by funding and capacity. SSMPS plans to enhance enforcement with drone surveillance and AI-driven tip analysis to counter adaptive trafficking networks. Public health officials warn of emerging threats, such as fentanyl mixed with xylazine, a veterinary sedative increasing overdose severity. Conclusion: a milestone in an ongoing battle. The October 21, 2025, seizure of $1,443,560 in drugs marks a historic milestone for SSMPS, disrupting a major trafficking operation and preventing countless potential overdoses. Yet Sault Ste. Marie's struggle continues, rooted in economic challenges, geographic vulnerability, and systemic gaps in addiction treatment. This bust provides a reprieve, but lasting progress requires sustained investment in prevention, recovery, and community resilience to address the root causes of the opioid crisis.